Dr. Brewer's patient was a girl of 21, of a high degree of intelligence. She had developed, in the course of 2 years' illness, a series of physical and mental disturbances which well deserved to be taken seriously. She had a severe paralysis of both right extremities, with anesthesia and at times the same affection of the members of the left side of the body, disturbances of eye movements, and much impairments of vision, difficulty in maintaining the position of the head, and intense ticus nervosa, nausea when she attempted to take nourishment, and at one time for several weeks, a loss of the power to drink in spite of tormenting thirst. Her power of speech was also diminished, and this progressed so far that she could neither speak nor understand her mother tongues, and, finally, she was subject to states of absence, of confusion, delirium, alteration of her personality. These states will later claim our attention. When one hears of such a case, one does not need to be a physician to incline to the opinion that we are concerned here with a serious injury, probably of the brain, for which there is little hope of cure, and which will probably lead to the early death of the patient. The doctors will tell us, however, that in one type of cases with just as unfavorable symptoms, another, far more favorable, opinion is justified. When one finds such a series of symptoms in the case of a young girl whose vital organs, heart, kidneys, are shown by objective tests to be normal, but who has suffered from strong emotional disturbances, and when the symptoms differ in certain finer characteristics from what one might logically expect, in a case like this the doctors are not too much disturbed. They consider that there is present no organic lesion of the brain, but that enigmatical state, known since the time of the Greek physicians as hysteria, which can simulate a whole series of symptoms of various diseases. They consider in such a case that the life of the patient is not in danger, and that a restoration to health will probably come about it of itself. The differentiation of such an hysteria from a severe organic lesion is not always very easy, but we do not need to know how a differential diagnosis of this kind is made. You may be sure that the case of Brewer's patient was such that no skillful physician could fail to diagnose hysteria. We may also add a word here from the history of the case. The illness first appeared while the patient was caring for her father, whom she tenderly loved, during the severe illness which led to his death, a task which she was compelled to abandon because she herself fell ill. So far it has seemed best to go with the doctors, but we shall soon part company with them. You must not think that the outlook of a patient with regard to medical aid is essentially bettered when the diagnosis points to hysteria, rather than to an organic disease of the brain. Against the serious brain diseases, medical skill is in most cases powerless, but also in the case of hysterical affections, the doctor can do nothing. He must leave it to benign nature when and how his hopeful prognosis will be realized. Accordingly, with the recognition of the disease as hysteria, little is changed in the situation of the patient, but there is a great change in the attitude of the doctor. We can observe that he acts quite differently toward hystericals than toward patients suffering from organic diseases. He will not bring the same interest to the former as to the latter, since their suffering is much less serious and yet seems to set up the claim to be valued just as seriously. But there is another motive in this action. The physician who through his studies has learned so much that is hidden from the laity can realize in his thought the causes and alterations of the brain disorders in patients suffering from the apoplexy of dementia, a representation which might be right up to a certain point, for by it he is enabled to understand the nature of each symptom. But before the details of hysterical symptoms, all his knowledge, his anatomical, physiological, and pathological education desert him. He cannot understand hysteria. He is in the same position before it as the layman, and that is not agreeable to anyone who is in the habit of setting such a high valuation upon his knowledge. Hystericals, accordingly, tend to lose his sympathy. He considers them persons who overstep science. As the orthodox regard the heretics, he ascribes to them all possible evils, blames them for exaggeration and intentional deceit, simulation, and punishes them by withdrawing his interest.